Thank you, Mayor Turner. I appreciate the opportunity to join you virtually as we practice social distancing. I want to commend the hard work that you and all of our local leaders and media are doing to keep the community safe and informed. Houston is home to Reliant and our people, and we care deeply about this community, and we're committed to helping one another through this unprecedented crisis. Today at Reliant and NRG, is being committed to local first responders, healthcare workers, and nonprofits as they provide crucial services to our neighbors here in this community. First, $150,000 is going to the City of Houston's new Frontline Fund to assist with much needed PPE. We're also providing $150,000 to the Houston COVID-19 Recovery Fund, which is a collaborative between the United Way and the Greater Houston Community Foundation that Jamey here with me today will speak about in a moment. These donations are part of Reliant's support in Houston and across the state of Texas, and they're a subset of our overall NRG contribution of $2 million to pandemic relief efforts. We're also providing assistance to our electricity customers who are facing hardships caused by this pandemic with payment plans and additional relief. I would just encourage, if you're out there and you need assistance, we encourage you to call or chat with us online. We're here 24 hours a day to help. As a native Houstonian and sixth-generation Texan, I've witnessed the strength and resilience of this community and have seen how we always pull together in times of need. Mayor, I want to assure you and the community at large that you can count on Reliant to help light the way in uncertain times. And I'll ask Jamey to speak about his fund as well.
Great. Well, thank you, Elizabeth, and thank you to your entire team at Reliant. You guys have once again stepped up and showed tremendous leadership for our community and support for our community. You know, Don Shula said, I know of no other way to lead than by example. You guys are setting a terrific example. And likewise to Mayor Turner, thank you for your strong leadership throughout this time of crisis and all of the challenges that our community has faced over the last few years. You know, COVID-19 has created unprecedented need in our community, especially for the most vulnerable families and individuals. These are neighbors that were already struggling to make ends meet when this pandemic hit. The sudden loss of a job, wages, childcare, can leave a devastating blow to families that are already living paycheck to paycheck. The Greater Houston COVID-19 Recovery Fund, which I am co-chairing with my good friend Tony Chase in my spare time away from being president of the Houston Texans, it will help these Houstonians with urgent basic needs like food, healthcare, and shelter. As always, Reliant has stepped up across Texas to support neighbors in need, and we are very grateful for this generous contribution to the Greater Houston COVID-19 Recovery Fund. In just a very short time, we've received millions in generous donations from foundations, businesses, and individuals. And in under 30 days, we have distributed and invested $1.5 million to 30 agencies across this region. We've just started and we are already making an impact. The need for the most vulnerable is great and it's urgent. So I encourage everybody who's listening or watching out there today to join our team for Houston. To donate now, just visit greaterhoustonrecovery.org. And if you're in need, call 211, the Texas United Way helpline. Again, thank you, Elizabeth, and our great friends at Reliant for once again being champions for Houston.
And let me thank both of you, Elizabeth. Let me thank you and Reliant for your $300,000 contribution. $150,000 of that going to the Houston Frontline, which is a nonprofit within the Houston Special Events Fund, with Susan Christian over special events for the city of Houston, and that Houston Frontline Fund is being used for the purchase and acquisition of PPEs for our first responders and healthcare providers. And then again, I want to thank Jamey Rootes who is one of the co-chairs of the COVID-19 Recovery Fund, and that is also a fund that is assisting so many Houstonians and people in the region in their efforts to overcome and get back on their feet from COVID-19. So thank you both. Reliant, a big thank you to you as well. Together they provide for our most vulnerable neighbors through local nonprofit organizations. I want to commend and thank them. Elizabeth, your donation will greatly benefit both citizens and city workers alike. And we had our fair share of natural disasters with Harvey, tax day floods, and so many others. And Elizabeth and her team at Reliant NRG have stepped up to support our greater community. But they don't stop here as well. They continue to support our neighbors nationwide. And I want to give a big thank you and express our generosity for what you are doing, and thank everyone who has donated, volunteered, made face masks, healthcare professionals, janitors, grocery workers, nonprofits, teachers, mothers, and fathers who are homeschooling, first responders, and all of our essential employees. And we'll work together, and we'll get past this particular crisis. So thank you to both of you so very, very much. Thank you all. Okay, that's going to end the first part. We're going to segue out. And let me also acknowledge Vice Mayor Pro Tem Martha Castek Tatum. Thank you again. And we've been at it all day, all this morning with City Council. Now, and Councilmember Tiffany Thomas, where are you? Oh, feel free to come up. She's back there. Okay, the Houston Health Department today, to give you the updated numbers, we are reporting 52 new cases of COVID-19 today. Yesterday, it was 40 new cases. Today, we're reporting 52, bringing the total case count in the city of Houston to 2,331. The total number of deaths has increased by 3. And so the total death count in the city of Houston is now 26. So 2,331 COVID cases, and then the people who have passed in our city as a result of COVID-19, that number is now 26. With respect to those 3 new cases of people who have died, one is an African-American man in his 80s with underlying health conditions who passed away on April the 8th, 2020. And then an African-American man in his 60s with underlying health conditions who passed away on April the 12th. And then the third is a white non-Hispanic man in his 50s with underlying health conditions who passed away on April the 5th. And again, when we say underlying health conditions, that means possibly heart disease, lung disease, may have been suffering from diabetes, sickle cell, asthma, all of those elements that were involved in their situation. I certainly want to extend my condolences to their families. COVID-19 continues to challenge our community, and I know it's heartbreaking to hear the daily report of positive cases and the number of deaths. But I also think we should keep in perspective that as the nation's 4th largest city, Houston has done an excellent job of blunting the progression of COVID-19 because you're staying home, or if you're an essential employee, you're working safely, and you're engaging in social distancing. And let me just say to you, all of those things, you are saving people's lives, could be saving your own, and then, of course, wearing the face coverings as well. I want to just show you a couple of charts before I yield to Dr. Peirce, who can elaborate on them even further. One chart, let me see what goes up first. This is a chart that shows the COVID-19 deaths by jurisdiction. So, for example, per 100,000 population, if you take a look at New York City, the number of deaths per 100,000 is 94.1. Okay? New Orleans is 70.6. These are deaths per 100,000. Seattle is 40.7. Chicago is 12.8. Los Angeles County is 3.6. The number goes on, and you can see where Houston is. We're at 1.1. We're at the very end when you look at deaths per 100,000. And today, our total count, of course, is 26. But when you look at the number of cases per 100,000, New Orleans would be first with 1,445, followed by New York. These are number of COVID positive cases per 100,000 population. New York City would be 1,272. Seattle would be 611. Chicago would be 334. San Jose would be 105. These are cases, confirmed cases per 100,000 in population. And the city of Houston would be right at 96 per 100,000. So just to kind of put things in perspective, what I do want to highlight is that the actions that people are taking in our city, those actions are working. Because oftentimes I'm asked, even on yesterday, Mayor, are the sacrifices that people are making in our city, are they helpful? Are they working? And I want to assure people, that's why I want to show them these charts. When you look at deaths per 100,000, quite frankly, we're at the end. When you look at cases per 100,000, we are way from New York and New Orleans, Seattle, those instances. And then in talking with the medical center today, with Bill McCain and others, I want you to know that there are signs that things are flattening, which is positive. And what they have said, and looking at their numbers, is that based on what people are doing already, at least as of today, the hospitals in our areas can handle the cases that are coming in within their baseline capacity. And that's good news. In terms of the ventilators, they're able to handle the cases that are coming in with the supply of ventilators that they have. And that's good news. With respect to ICU beds, they're able to handle the cases that are coming in within their baseline capacity. And so we want to keep it that way. I said before, we're going to take it one day at a time. Yesterday, we were in a position to say we've been successful. Today, I can say we're being successful. And if we continue to stay home, if we continue to work safely, if we continue to engage in social distancing, wear our face coverings, then each day, I think we can continue to flatten that curve, slow the progression of this virus, and stay within our healthcare delivery system ability to handle those cases and provide the necessary care to the people that are coming into our system. Having said that, let me pause and bring up Dr. Peirce.
Thank you, Mayor. To reinforce a couple of things the Mayor said and to go into those charts a little bit more, remember when we started all this, we said right from the very beginning, the whole purpose with all this effort was to save lives. And part of that is a very complicated strategy, which each and every one of us is living that strategy. Our deaths, when compared to other cities, remain low. And so there are the two charts that were up there, and the one just showed the number of deaths in the largest cities across the nation. And of course, New York City had a very high bar, and then the others look small. But that doesn't tell the whole story because of the much greater population of New York City. So in the other graph, the one per 100,000, it balances that, and it looks at how many deaths per 100,000. So it takes the population, the greater population of New York City. So there's the graph there that shows the total number of deaths in New York City, and it dwarfs all the other cities, but so does the population of New York City. So if we can go to the other graph, the one that is per 100,000, this takes the confounding variable of population out of it, and then if we go back to the other one, again, please, this graph, if we leave it there, this takes the population density, the total population of the community, and it compensates for that. So you're now looking at more the rate of death per population. And you can see that when looked at this graph, although the letters on the bottom are very small, Houston is very far off to the right of that graph, indicating that we have a very small number of deaths per our population, which means that all of these things that we are doing, all of these strategies that have been put in place by Mayor Turner and Judge Hidalgo are working, and they're working today. Remember, I've also said before that anytime you do a public health strategy, it takes a minimum of 2 weeks before we see it reflected in the numbers. And so we've been doing this for several weeks now, and there it is, on that chart, is the proof that what we are doing is saving lives. Mayor pointed out how the numbers from the Texas Medical Center from that group, that select group of hospitals, is showing some encouraging news. But I want to remind everyone that when we hit, when we hit the peak, whenever that should be, that is not game over. That is halftime. And then more work is going to need to come in as we try to, and this is not my lane, this is the mayor's lane, but how we restart society. It'll be my job to help advise the mayor on how we do that while at the same time protecting folks, because the virus is still in the community and the virus doesn't care. And if we give the virus an opportunity, it will take it. So as we move forward, everyone in the community needs to keep that in mind. And if we do so, we will continue to be as successful as we have. If you think about it, Houston is the 4th largest city in the nation. And if you look at where we are in that graph, that is remarkable. Probably not something anybody would have predicted 2 months ago. So to the viewing public, be proud of yourselves. You're doing the job. You're not done, but you are doing the job.
And so we want to encourage you to continue to do it. And again, we're not showing you these drafts to say that it's over, claim victory, mission accomplished. That's not the reason why we are showing it. The reality is, if we don't stay the course, those numbers can quickly change, as we have seen what has taken place in other cities. We're showing you these drafts and providing you these numbers to indicate to you that what you're doing in this city, those things are making a positive difference. And we need to continue to do it, that the sacrifices that we're asking you to make are critically important. Now, let me also say, when you look at the 23 people who have passed, all of them have suffered with underlying conditions, which means that there are many other people out there in our city who are suffering with these underlying conditions. And so we have to protect them. So people who are vulnerable, people who are at risk, our seniors, even younger individuals who are suffering with diabetes, sickle cell, asthma, recovering from cancer, lung disease, heart disease, all of these individuals are vulnerable. And if we don't take the necessary steps to protect them, then we all will pay the price. So that's why the facial coverings are so critically important. But I do want to thank everyone for what you continue to do. Bear in mind, we are testing everyone in the city of Houston. If you desire to be tested, whether you're symptomatic or not, we're testing everyone. Please call the City of Houston Health number to get an authorization code, and then you can proceed to the testing site. We can do up to 500 per site, 1,000 per day. So we are testing everyone, whether you're symptomatic or asymptomatic, because it's through the testing that we will be able to make the decision as to how quickly we can open up and what phase, to what degree we can open up. And it's all in the testing. So we need that data to kind of measure the degree of the community spread. Who has had it, who may have had it and recovered, all of that information will be important. Now let me turn to Chief Pena.
Thank you, Mayor. I'd like to begin my report today by giving you a quick update on Captain Capistran. He's the fire captain that was in the hospital as a result of COVID-19. Again, he is out of ICU. Last I spoke to his wife on Monday, he is doing better, he's improving, and he's hoping to be released sometime this week. So please keep him in your prayers and pray for a full recovery. In regards to our quarantine numbers, we maintain the positive trend that we've established the last week. We are down to 75 firefighters in quarantine. Throughout this process, throughout the operation, we've had 29 firefighters cumulative who have tested positive for COVID-19. 14 of those have since returned back to duty, and the other 14 are recovering at home. Our occupancy task force, they had 67 complaints in the last 24 hours, all resolved with voluntary compliance. We issued no citations. So we're trending positive as far as the protection of our personnel and the exposures, but we continue to dig that fire break. Just this week, we're introducing some new decontamination equipment that we'll be deploying out to the stations. as well as some training to ensure that we are doing the proper thing to keep the stations decontaminated and the equipment decontaminated to ensure that our firefighters are safe, have a safe working environment. And that is my report. Thank you.
Thank you very much. Chief Slinker, HPD.
Thank you, Mayor. Also some positive news. Let's continue on that trend today. We'll take it wherever we can get it. And with HPD, the main message for today is for you to know, for our citizens in Houston to know, that if you need your police department, if you need help, we will be there. We are still operating at full capacity, and we will be there to answer those calls when they come in. Our calls for service since the beginning of this have been flat or slightly decreased, anywhere from 4 to a 2% decrease. Today we're sitting at about 3% decreased from where we were last week. And so that's allowing us to prioritize those higher emergency calls, which is very good for us that our call volume is staying relatively flat. Mayor, today, for the first time since this began, since we started quarantining individuals for various reasons, we are now below 100 that are in quarantine with the Houston Police Department workforce. We're at 91 total in quarantine. That includes 68 police officers of various ranks and 23 civilian support staff. Regarding our testing numbers, we've had 163 total tests with 36 positive. This is the breakdown of that. We've had 153 officers tested, resulting in 35 positives, 84 negatives, and 34 that are still pending. We've had 10 civilian support staff tested, resulting in 1 positive, 5 negative, and 4 pending. So our total number of positive remains at 35, which is, I believe, where we were yesterday. And our return to duty of those who have been positive, that 35 is a cumulative number, like Chief Pena said from the beginning, and 11 of those have returned to work and have recovered. And so that's good news, and that's trending in the right direction. And I want to make a parallel correlation here with the things that we're doing in the city, the things where we've received support from the mayor's office, from council, from Chief Bunick over at OEM. The things that we're doing at the police department and within the fire department, if you look, I think Chief Pena said your positive cumulative total number was about 29. And then we're sitting in the police department at 35. So very close. So the fact that we're doing similar things, the fact that we are implementing the same protocols, whether it's temperature screenings at our stations before a shift begins, the fact that we early on got on top of donning the proper PPE when we have to have direct contact with citizens, that started weeks ago. And then all the way to our employees wearing these masks in the workplace regardless of your assignment. All of those things, I think, are paying dividends because being the 4th largest city in America, the 5th largest police department in the United States, while it's tragic that we still have one in critical condition in the hospital, and we definitely don't want to see any of our officers fall ill, I think it is a testament to what we're doing, Mayor, that in the 5th largest police department in the United States of America, right now we have 35 that are positive, and that number is not a lot higher. So I think those are some positive things today. We still want to pray for Officer Cervantes, who still is in the hospital. His condition has not worsened, but we'd still like to see some more improvement. So continued prayers would be appreciated. Thank you, Mayor.
Chief Bunick. Chief Bunick. Yes, sir. Oh. Chief Bunick. Anything?
Yes, sir. Thank you, Mayor, and thank you for your leadership during this crisis. The Office of Emergency Management's been working hard, coordinating and working with all the other city departments to ensure that the city is functioning as it should be. All of our continuity of operations plans are up to date, and we are getting each and every individual department the equipment they need and the protection of their employees so that they can perform their duties. The other thing I'd like to mention is the Greater Harris County 911 Board has given us a portable building that we placed in the parking lot at the Houston Emergency Center to give us additional capacity and additional space for 20 extra workstations in the event that we have to vacate a certain area, whether it's for cleaning or just to make employees feel a little bit more comfortable. It just gives us another option. Additionally, we set up 2 other work areas that aren't normally used during police and fire dispatch and 911 operations. So we have the capacity at the Houston Emergency Center to move and isolate employees as needed to keep everybody safe. Thank you, Mayor.
And then before we take questions, I know Vice Mayor Pro Tem Martha Castack Tatum has been very, very active with the other city council members and within the community. And I know you're very much engaged, and so please, encourage these.
Thank you, Mayor. Just want to take a few minutes to encourage people not to get weary. All of the great strategies we have in place and what we are doing is working, but we cannot stop now. One of the things that resonated with me that Dr. Peirce said in our meeting last week was, once we reach the peak, that is not the end of the game. If anything, that would be halftime. So please continue to stay home. Wear your face coverings when you're out getting essentials. Wash your hands. Practice social distancing. We will continue to combat this virus together, and we will come out stronger in the end, and we will get through this.